Hello friends, and welcome to today's discussion on the topic Posology. Posology is a Greek word in which posos means how much and logos means science. So it is, in English, Posology is science of how much. It is defined as Posology is that branch in medicine study that deals with dosage of medicaments. That is, the dose for a particular medicament varies depending upon the various factors. Here, we shall study the different factors that influence the dose of the medicaments. The various factors that influence posology can be enumerated as: first factor, age; sex of the patient, whether male or female; time of administration; route of administration; body surface area; body weight; drug interactions; pathological condition; psychological state of patient; idiosyncrasy; environmental factors; and tolerance. So these are the different factors that influence posology. Let us study all of them one by one. The first factor, age. The dose of the medication varies with age. The age group of human population is being categorized in different categories: neonates. They are infants from 0 to 30 days, newborn babies; infants up to 1 year of age; children from 1 to 4 year of age; children from 5 to 12 year of age; adult population, geriatric or old population greater than 60 years of age. The dose will vary depending upon the age of the patient. There are different formulas which have been given by scientists for calculation of doses in infants and children. First is Young's formula. This is given for calculation of doses for children below 12 years of age. The formula for child dose is age of the child in years divided by age of the child in years plus 12 into adult dose. There is another formula based on the age for calculation of doses for children that is given by Billings formula. Between child from 4 years to 20 years of age. Age of the child divided upon 20 into adult dose. That is third formula, Cowling's formula. Where the child dose is equal to age of the child plus 1 divided by 24 into adult dose. There is a fourth formula called Reid's formula, which is age in months divided upon 150 into adult dose. So these are the four formulas based on the age of the child. They can be used for calculation of doses that can be administered to a child given the adult dose. All the dose that is mentioned for the standard population is based on the standard weight of 70 kg of an adult having a body surface area of 1.73 meters square. And all the doses that are mentioned on the leaflet is mentioned only based on the adult population. So for children, they need to be calculated and dose needs to be adjusted. Let us study the next factor. Based on the sex of the population, whether it is male or female, drugs are chosen. For example, in lactating mothers, pregnant women, and menstruating women. In these two conditions, purgatives are prohibited, not allowed. In pregnant women, NSAIDs, non-steroidal anti-inflammatory drugs, are prohibited after 20 weeks because it causes kidney underdeveloped, and loss of amniotic fluid. That is, it can lead to the fetus not developing important organs like kidney, heart, lungs. Thereafter, there are certain drugs that can be secreted in the breast milk, so they have to be avoided and not to be administered, not to be recommended for lactating mothers. Sedatives are some of the examples. Also, antihistamines. Then the third factor is body weight. All the doses that are mentioned in the leaflet is based on a standard body weight of an individual, adult individual, that is 70 kgs. So in case of an obese patient or very thin patient, dose calculation needs to be done. That can be dose to be administered is equal to weight of the individual divided upon 70 into adult dose. The fourth we discussed is body surface area. The average individual has a body surface area of 1.73 meters square, and all the doses which are mentioned is based on this body surface area. So any calculation based on body surface area adjustment can be done as body surface area of the child divided upon 1.73 into adult dose. Let us study the other factors. Environment, factors. For example, patients are administered stimulants in the morning and sedatives in the night. If the sedatives were to be administered during the daytime, higher doses would be required. Psychological factors. For example, if a patient is nervous, higher dose of general anesthesia would be needed. Before an operation. Okay. Now, what is the next factor? Pathological condition. That is the disease states. There are certain people who have impaired liver function. They have liver cirrhosis, so the drugs cannot be, those drugs which are metabolized by the liver should not be given in patients with impaired liver function. There are certain drugs which cannot be administered. They have to be administered at a lower doses for geriatric or patients with impaired renal functions. For example, lithium, digoxin. Since the renal is impaired, these drugs, which are primarily excreted through the renal kidneys, they are not excreted efficiently. As a result, higher concentration of these drugs are present in the blood. Steady state in the blood is highly increased as compared to normal patients, as a result of which it may cause toxicity. So for patients with impaired renal function, dosage adjustment has to be done for these drugs, especially highly potent drugs that are excreted through the kidneys, and accordingly they have to be administered. In case of liver impairment, most of the drugs, including morphine, most of the drugs are metabolized by the liver, so they have to be administered at a lower dose. Patients suffering from achlorhydria or less gastric acid secretion should not be administered aspirin, because aspirin will not be absorbed. Let us study the other functions. A certain drug A, when administered with certain drug B, will give a combined effect of A plus B, which is known as an additive effect. A certain drug A, when administered with a certain drug B, may cause a greater effect than the combined effect. This is known as synergistic effect. An enhanced effect than the combined effect of both the drugs. Drugs, when administered together, causes a reduced effect, that is antagonistic effect. Additive effect example is aspirin and paracetamol. Aspirin and paracetamol both are antipyretic and analgesic. So they have to be administered. When they are administered together, they produce an additive effect. Synergistic effect, for example, trimethoprim and sulfamethoxazole. When administered together, causes a synergistic effect. Antagonistic effect, histamines and adrenaline. They have an antagonistic effect, opposite effect to each other. The other factor that influences posology is route of administration. As we all know, intravenous is the fastest route of administration. Because the drugs are injected directly into the bloodstream, it is immediately available in the systemic circulation for absorption, thereafter intramuscular, thereafter subcutaneous, followed by liquid dosage form, followed by solid dosage forms. The other factors is time of administration. Certain potent drugs are meant to be administered empty stomach. Certain drugs which bioavailability is improved in the presence of food. For example, griseofulvin bioavailability is improved in the presence of high-fat meal. There are other drugs like fenofibrate, tamsulosin, metoprolol. Their bioavailability increases in the presence of food. Certain drugs whose bioavailability decreases in the presence of food include most of the drug. For example, in presence of grapefruit, their absorption decreases because grapefruit is not juice, is not compatible with most of the drugs. There are other drugs like antibiotics, penicillin, cephalosporins, tetracycline, ampicillin. We have reduced bioavailability in presence of food. Let us study the other factors. Tolerance. Increased tolerance can be observed in certain patients. It could be either natural. For example, certain African population and rabbits are increased tolerant to atropine. So increased dose is required. It can be acquired. Tolerance can be acquired. For example, if a particular drug is being administered continuously for a long duration of time, tolerance is developed and toxicity may also develop. For example, drugs like antimalarial drugs, when administered continuously for a long duration, a higher dose is required for desired efficacy. The third is certain drugs which have the same pharmacological receptors. One drug may interfere the action of the other drug. There are certain specific daily examples. For example, alcoholics may require higher concentration of sedatives. For desired efficacy. Tolerance is also a specific type called tachyphylaxis. Tachy means fast, phylaxis means resistance or protection. So tachyphylaxis is observed when dose keeps on increasing and then later on resistance is developed to that particular drug. The classic example is anti-malarial drug, chloroquine. And it may also cause retina damage. Let us study the other factors. Idiosyncrasy. This is unexplained behavior that is observed in certain patients. For example, morphine is a sedative and a painkiller, however, has excitatory effect in certain females. This is known as idiosyncrasy. Penicillin it's an antibiotic, prevents the growth of the bacteria. However, there are certain cases of rash, allergies. There are certain cases of anaphylactic shock also. So these are the adverse reactions that are experienced when there are certain category of population or patients when they take penicillin, they have experience of adverse drug reactions. There are certain formulas for calculation of the dose of the child based on the body weight. This was given by the chemist or the scientist, Clark's formula. Dose of a child is equal to weight of the child in pound divided by 150 pounds into adult dose, or weight of the child in kgs divided by 68.2 into adult dose. Veterinary dose calculations. Doses in animals are higher than human doses because they have a higher body weight and higher body surface area. For example, cattle population and horse has a body weight of 500 kgs. Pigs have a body weight of approximately 150 kgs. Dogs have a body weight of 10 kg. Cats have a body weight of 5 kg. Rats have a body weight of 750 grams. Rabbits have a body weight of 2 to 3 kgs. All the doses are mentioned mg or grams or kilograms per kg body weight. Accordingly, all the calculations are adjusted and the dose is given. So this brings us to the end of the chapter Posology. We discussed what posology means, the various factors that determine and influence the dose calculations or posology. There are approximately 12 to 13 factors which influences the dose calculations or posology. That brings us to the end of the discussion of this topic. Thank you. Have a nice day. For any queries, you can reach out to me at suhani.sinha@gdgoenka.ac.in.